Namaskar. We would like to
Namaskar.
welcome you all on behalf of Independent Research Ethics Society, AYUSH Samriddhi International Webinar Series at milestone of 2445. Thank you for your greatness, mentorship, active participation, and valuable guidance, due to which we have been able to continue this journey up to 2445. Thank you very much. Thank you to all. Thank you to YouTube viewers also. Today, topic is very important, unique and serious. How our Ayurveda would be first choice of treatment. So, on this unique topic, the legendary Ayurvedic expert with unique concepts, Ayurveda Ratna, Ayur Dr. Avtar Singh sir, renowned herbal medicinal practitioner, founder of Siddha Ayurvedic Clinic, Academy and Research Center from London, UK, will guide us. Welcome, sir. Welcome. This
Thank you
platform.
very much, Pawan ji. पहले तो I say we miss you all here. You आ नहीं सके. सभी लोग यहाँ से डॉक्टर कुलदीप पांडे जी से भी हमारी बात हुई, वो भी थे, ओम जी से, सभी जोधपुर यूनिवर्सिटी से, अखिलेश जी, प्रदीप जी, सभी यहाँ हमने आपको बहुत याद किया. चलो नेक्स्ट टाइम तो आपका प्यार हमेशा सभी जानते हैं, तो उसके लिए हम कल फिनिश हुआ कॉन्फ्रेंस, कल शाम को, कब लेट, तो अभी यही है, मिलजुल रहे हैं सभी. ये जो this concept, which one you chosen today, we discussed last week, and thanks very much. We discussed as you choose, and this is the most important subject at the moment. We need to find out Ayush Ministry doing, Modi ji doing best. He done from last 8, 9, 10 years, Ayush Ministry, they made is everything. But still not the first choice of the public. We have to think about now. We got this opportunity first time after many years. How can we improve ourselves? How can we make trust in the public? They start first thinking about the Ayurveda treatment when they have any problem. But this one, no one I heard thinking about this way. Everybody say people don't like Ayurveda, some people like, start liking that one. That's not enough now. Ayurveda, if it done the properly, there are so many Ayurveda practitioners, they're doing very well, but so many are struggling. So many Ayurveda students, they're coming out, they are not happy like other therapies, other doctors, like allopathy, homeopathy. They are more successful. People are going, they are more than Ayurveda practitioner. We can't ignore this thing. We have to find out. We have to think about this one. What is the reason? I spoken to many other doctors. Many say what we can do it. Then I told them today we discuss on that one and what is my views, what I found. I definitely share with all the colleagues, my friends, students, youngster, anybody. Maybe little what I'm say, people is hard to observe, I say, not to understand. Understand everybody. thinking, everyone is thinking, what is the reason we spend the same time like an MBBS doctor? Why not we, our student, why not our children are successful? They're doing the same time. When they start Ayurveda, doesn't matter what the reason, doesn't matter, Ayurveda is second choice. If they can't get any other MBBS, then they say, okay, do the Ayurveda. But if after that one, 5, 6, 7 years they spend on the Ayurveda, and after that one, they are not successful, how can other people come and they go to depression, they go to then running around this one, they do, and then using other medications? As you also discuss on when we were discussing that one, why? If they learn the Ayurveda, I'm doing Ayurveda nearly 60 years now. I'm not using any other therapies. I respect every therapy. They have their own protocol. They have their own system. They have their own medication, what they made it. We, as a Ayurveda practitioners, Vaidya or doctor, they are same thing. In the English, they call doctor. In our language, call the Vaidya. In Unani, they call Hakim. In Farsi, they call Tabib. Many people are confused on that. Why Ayurveda people say doctor? Because we are speaking English now, because not so many people in foreign, they understand the Hindi. This doctor is a common name in every therapy. Worldwide, English is like a whole world's one common language. You can speak. That is an, they call the doctor, that is an Ayur doctor. Not the doctor. We are not the doctor. We are Ved. We are proud to be Ved. But people not understand. We call the Bap, we call, koi call Abba, some people say father, some people say Pidar. So these are the, many people just stuck on there. Oh, you are the doctor, you are the Ved. They are English Ved, you are Ayurveda Ved. Don't stuck on there. Don't bother that one. Just what you can do for the human. When people come to you, when they are sick, what we give the result, people say people only need the result from any doctor. Doesn't matter he is Ved, Ayurveda doctor, doesn't matter allopathy doctor, doesn't matter homeopathy doctor. People have no other relation than more than this one. Patient and doctors. Mareez and Vaidya. This one we are each other hating each other. How can you call the doctor? How can you do this one? How can they are this kind of language they're using? And even Ayurveda doctor, Ayurveda Vaidya, oh, Vaidya doctor, same name, like your father and Pitaji, what's name? In English, they don't understand what is meaning of Pitaji. We stuck. So come out from that thing. We are living in the modern world. We're living in the internationally now. If we want to take the Ayurveda internationally, don't stuck on there. Come out from this grave to how can we make the public, they start believing in Ayurveda. And if they're not believing, why? Why is very powerful word. We have to find out the answer of the why. Not somebody else can let us know. Why not? Less than 200-year-old allopathy is everywhere. Everywhere people want to go there first. And some people say Ayurveda is 5,000 years ago. I say no. For Ayurveda, नाभ कमल ते ब्रह्मा उपजे, वेद पढ़े मुखचार सवार. ये ब्रह्म विद्या है. I spoken many times. And Dr. Joshi, 2-3 times they asked me. I said, Dr. Joshi said, this is the Brahm Vidya. We have to be Vaidya, like a Vaidya's responsibility, Vaidya's duty, Vaidya's dinacharya. Then we can cure the people. It's no problem. They written only 5,000 years ago. Ayurveda is when Srishti Utpan, then Parameshwar Prabhu, same time to protect the human body. Because we are, हम राम की अंश हैं, प्रभु की अंश हैं, उसने बचाया हमें. So we have to think this way, not think what other people saying, what other therapy saying we are. No, we tell them, we are failed to tell them who we are. We are failed to tell them what we can do it, Ayurveda. This is the most important. Then public is becoming more education nowadays, not like before. Before was only 2-3 language. Now it's so many language people learning, and we fail to tell them what is the Ayurveda. And we fail to tell them, public, what Ayurveda can do it. Because many of Ayurveda practitioners, we can't find many successful practitioners. We can find who learn the Ayurveda. Until practically we are not the confidence, don't have in the Vedya, we can't do it. Many, I told before 2-3 times, when patient come to us, we have only 2 to 3 minutes to diagnose. Doesn't matter we spend 2 hours with the patients, take the detail, 3 hours, 4 hours, full day. But until we not diagnose properly, this is the Ayurveda, the first instruction to the Vedya. When you diagnose, then you can make the medication. We don't have to follow other therapy, other therapies all after Ayurveda. In all the therapy, they know what Ayurveda say, how many bones, how many muscles, how many systems. They also using on that one. They done more research. We not done proper research. That reason we sometimes fail. Some Vedas fail. They say, people not coming to us. People come to us. People definitely come to us if we do the proper job. If we do the proper medications. If we make the medication what requirement of the body. If we diagnose properly. Yesterday in the conference, I say, human body is sitting on the 3 legs, 3 pillars: diet, medication, and diagnose. One pillar is missing, you can't sit on that table. These 3 things Vedya should know. What is the Prakriti, what is Vikriti, what kind of the weather, all things until Vedyas don't know, can't cure anybody. This is the missing in our nowadays Vedyas. That is when a patient comes, they want a quick result, no doubt. In Ayurveda, I'm doing that one. I'm 100% in the UK doing Ayurveda, what I learn, what Ayurveda say, I try to do my best. I have no any problem. I'm not compromised with my medications. Now we have nowadays so many problems, so many company-made medications, they're not making properly. We have to learn the medication. If we don't learn the medication, doesn't matter, next 1,000 years, we can't satisfy our consumers. Our patient never be satisfied with us. If we want patients come to us, they love to come to us. Who they want to pay the 50,000 pound, 1 lakh in rupees in the hospitals? No one want. Vedya can do within 5,000 rupees. And we are missing that link, and that's enough. If we make the proper I don't put the name of the companies. You can see the many medication, like Chavanprash is the best our medication. You can take, everybody can take that one. What price they say they are? They're selling the names now. They are business people. If you make Chyawanprash at home, you can find a local, maybe expensive, but that is the best medication. Even we don't want to make the Trifla. And they have to learn how you make these kind of things. And Vaidya should do their own. If many Vaidya I know, why not you making, oh, I don't have time. Then what are you doing? Many our medication are very easy to make formulation. But when you find the buy from the company have lot of companies. There's where they should do it then. And also I request to the India government, please take control of them and check them. Don't let them sell the name of the medications. Ayurveda's formulation still very strong, very helpful to the human body, very helpful to the Vedas. But if you buy, we don't know how old ingredients. Ayurveda says you can't use any herbs more than 6 months to 1 year. We don't know how old they're using. We don't know the expensive herbs they're using properly. This is the one reason. We are not using Ayurveda formulation medication. We can't find, or no, everywhere they are not doing by hand. Please do it, make it your own, not hard. If I can make in the UK, 80% of my medications I make in here. I got the result, people are happy. Why not everybody can do? If I can do it, don't say I'm old, okay? I know you say this one. If in this age I can do it, why not other doctors do it? If you become the Vaidya, stay like a Vaidya. Don't think you are a other therapist doctor, they putting tie and everything. Stay like this your life, give the result to the, this is the God, I think you choose every Vaidya for the human. And you have to charge them. Many don't bother what they say. If somebody say, oh, if you are expensive, that's no problem. Tell them, try somewhere else, come back. We do the result. Like when I start this one, I got also problem here. Then I say to satisfy the patients, I say try 2 weeks. If you can't get any result, go somewhere else. Don't waste patients' time. Second, this is the first my advice to my colleagues, to don't waste patients' time. Most of patients have the complaint. They say, oh, we try 6 months Ayurveda, we not got any result. Or Ayurveda is, or if they're very slow result, they're not happy. Nowadays, everybody is very fast. They want fast result, and Ayurveda can do it. In Ayurveda, lot of they are expensive, but tell the patients, okay, if you want fast result, you have to pay for that one. Don't be charitable trust. People are most in their mind, Ayurveda is just like a few herbs things. Or many media MD doctors, I call them, they are selling everywhere. I told them, you don't know about the prakriti of that one, and don't do that one. If you do this way, patient definitely come to you. After 2 weeks is more than enough. Even 1 week, even 3 days, if you diagnose properly, then within 2 to 3 days, your system start working. Ayurveda medicine best for the immune system. There is no any medication like Ayurveda in the world who can control your immune system. Nowadays, there is big like a problem. Oh, this is going to autoimmune disease. What is the autoimmune disease? In Ayurveda, we have this one autoimmune disease. When the Tardosh come, they go to autoimmune disease because the system is not controlling themselves. They're confused. What in my research, what I found, what I'm doing, how I getting a result, I can share with everybody. Don't look after. We have the 10 vital organs. Just look after them. We had an endocrine system like a allopathy, say 43 glands. Balance them. When they unbalance, then they definitely go to autoimmune disease. But there we can cure them. We can bring them in the balance. You have to find out what kind of dosha is gone, what kind of dosha is mixed, that one, how to reduce that is that they learn BAMS, that one. Everything they learn, but just need to be more little bit study. And if they can't find out, they're struggling, then ask their seniors who giving the result. Just don't be shy, don't be egoistic. I've spoken with many. They ask him in the conference, a very successful conference. Many practitioners who are young, they ask me, "How are you doing?" When they watch my videos from the biggest problem in our community, they don't want to come out. Even I treated many people. They never become the problem again, but they don't want to share with somebody. I can say I'm lucky. The white people start sharing with that one, my treatment. When their treatment, they say no problem. Our people never share. Our people, sorry to say this one, even our colleagues, some, they don't want to share. Only Dr. Joshi, I salute to him. He's a big doctor. Is the one case, biggest case came last year, Michael's case. Angela Hopmuri, she referred to Dr. Joshi. Dr. Joshi referred to straightway to me. And on the that one, yesterday was represented that the lady, Ila, she's a Ayurveda student of mine, also learning Ayurveda. And what after that one, many people start liking that one. And people are curing and they're spreading the message. Our people, they don't want, many people even say to me, if we put that in the website, I say feedback from heart. What is the truth? I don't want any false thing, anything. I challenge to them, anybody, if I said anybody, write it forward on me. From some in the people, doctors, they say, they are praising each other. Dr. Joshi write about me many things. And they start thinking the praise. Some people say, no, definitely he's using the allopathic medicine, steroid or antibiotic. Then I put the challenge on that one. They don't happy. I say, why are you doing? Just discuss. If any problem, I'm always available. I sometimes hurt. I want Ayurveda be successful like other therapies. I want people's first choice should be Ayurveda. We can cure. Here in the UK, I tried to that formulation. They're very much expensive. Need $500,000 to this one to spend. This kind of country law not allowed easily. So if we in India, Ayurveda, we can go. Then I decided in my mind, we have a 150 crores. We have the Sri Lanka, we have the Nepal, and outside we have more than 250 crore our people. There is enough for to cure them. Are they healthy? No. They have a lot of disease problem. Why they have? Because they can't find the treatment from any other therapy. They are still struggling, and Ayurveda is not thinking. Our Ayurveda people are not coming together. I always say, yesterday I also say, I said, don't think what I'm saying. You can discuss with me how I'm doing. How I'm doing, I'm treating, I'm telling what is the proper way, what I'm doing. Please listen, believe, and do it. If you can't successful, then you tell me. You wasted our time. Which way I do, I'm doing, I'm doing 100% like what Ayurveda, our Acharya says. Not using, I done my research, I done found out nowadays what is the problem. or how big problem, they are not, they're 3,000, 4,000 years ago, they written, there's different. Now is different system. Now is everywhere is pollution, every water, food, everything. We have to find the new ways. Like every therapy, every pathy, they're looking at new drugs. They're looking at new ways to control those things. We also have to do that one. Then definitely we can make people happy. We can cure people then. If we don't do that one, we stuck on that and don't think what the other people is thinking. Just do it what Ayurveda is saying. What I am saying, just think, listen, you can discuss with me, we can do the more programs. I can share how to do it. The different patient need, Ayurveda never say, this is the medication is for one only for the liver problem. We have the nearly 40, 50 formulations in Ayurveda. We have for the kidney, have so many formulations. For the brain, everything. We have the so many. Why they made the so many formulations? They know what our body, what time, what prakriti, what system, what the reason of the problem. We have to find out these things. Until we don't find out these things, this never will become the people's first choice of Ayurveda. And Ayurveda people always struggle that one. This is my message to all the Ayurveda practitioners. Please forget what the other people saying about us. No. Ayurveda is first lesson to find out the prakriti, vikriti, and everything. Then you can cure the people, then you can relieve. Once people start getting benefit from that one, they are happy. They definitely, why they spend the more money in the hospitals? They can definitely come to Ayurveda people. And Ayurveda, I'm not saying who dying, doesn't matter what they're saying. I just only one thing that before 200 years ago, there was not so many pathies. Only was Ayurveda and the herbal therapies. So these were, think about this one. What other, are they successful? Are they have the without side effects any medication? No. This is all proved. But Ayurveda maybe have the some side effects when we don't wrongly given, when they do the bad parhezi, when they don't follow the diet properly, then they react. Ayurveda herbs are also very powerful. They can give, if you do the proper diagnose, proper make the herb, what is the requirement, what kind of herb you're using, use that kind of herbs, which one is perfect. Not use the name of herbs, not use the name of formulation, who making that one. Do it your own or buy very reputable company. They may be expensive, but you can tell the patient, we can't do the cheap. Don't do the bargaining with the patient. That is the biggest problem nowadays. Many Ayurveda doctors, Sarvo, they don't want to pay anything, so we have to adjust. There's no any adjustment in the treatment. No. If you are doing the adjustment, then you are not the proper Vaidya. Either you give the free from your pocket, either tell the patient, this is the cost effective. Don't do the bargaining. Don't cut the corner in the Ayurveda medications. Do the proper ingredients, buy the fresh ingredients, buy the company from which one is very good. If the company is no good, I'm not buying. 80% I'm making in UK my own medications. That is, and I'm getting results. I have nearly 500 square feet my clinic and my laboratory. So this is my message. Okay, Ayurveda, how can we bring online? How can we get the result? How can we satisfy our patients? They can come first to Ayurveda. Ayurveda is a lot cheaper than other therapies. Thank you very much. Any other question? Now half an hour I spend my time, and I can talk more. But if somebody want to question, and Pavanji, so
With your kind permission, I would like to communicate something, sir, if you kindly permit me.
you are the boss. Yeah.
Sir, in my opinion,
Yes.
now we have conducted evidence-based research right from 70 years after independence.
Mm-hmm.
So many researches are being conducted and have been done. But unfortunately, those researches are closed in the shelf of universities or shelf of companies. I was vice president of Imami Limited,
Yeah.
Jandu. So I know every company is spending crores of rupees on clinical researches, evidence-based researches, and those researches are published in the form of research paper to market that product, that our product has efficacy, number one. But those researches are not being utilized by the common public, or those researches are not reaching towards normal people. How people will get regard on our Ayurveda? In India, where the mother of Ayurveda or lord of Ayurveda, whatever we can say, were here, at present, allopathy is the first choice of treatment for Indian people also. Not for global only, but Indian people also. Because they don't, the public has not seen evidence-based research, or public is not, public is a, means in Corona, last Corona, public was treated like a guinea pig. Remdesivir, then this, and then vaccine, then super vaccine. So public was experimental in that case. But now Omicron has come again, and we have our capability to prove that our Ayurveda is best on the evidences against not only Corona but LSD also. Modernized education and practice. In India also, now syllabus has been modernized, number one.
Very good.
NCISM has taken trouble to modify the research, because it was not with us to communicate the modern society that what we have read. What we have read? Charak Samhita, Susrut Samhita, Bhagavad, Ashtang Sangrah. So many texts we recite there in front of any British people or in front of any American people. But at the last of our speech, he was unable to find out, he was unable to evaluate that what study we have done. So now, within these 4 years, NCISM has greatly modified our syllabus, and now we can show the syllabus to international persons that this is our reading on the modern parameters, on the ancient parameters, on the quality control parameters, on experimental parameters. Everything is calculated on our basis, like any university does it. So our modernized education, modernized practice. Previously, doctors were focused on the pulse diagnosis, and I'm unable to, because I have visited 55,000 clinics, sir, in India on behalf of Imami and Jhandu. What I found, in one page, in one hand, pulse is there, in one hand, pen is there, queue of patient is just in front of him. So he is trying to solve the puzzle very quickly, not giving time properly to the patient. So various pulse equipments have been launched. Maybe Nadi Tarangini, approved by NCISM and approved by Government of India. Maybe Veda Pulse from Russia.
I
Maybe
know.
Sanaya from Sanjay Chajar. So many equipments are there now available to identify and evaluate your pulse into percentage form also, graphical form also, and would suggest that you should take this, you should avoid this. So now this is also modernized. Various equipments. Previously it was thought that Panchkarm center will be a big center, big uh, big equipments, big Swedan room, big massage chair. Now it can be accommodated within 10 to 10 by 10 square feet of the room, whenever we would like to. So modernized small equipments are available. Previously, when I did my MD in 1989 from Jamnagar, there was no equipment, age runner or end runner popular. So we were just motor and pesling, kharal mein mardanam, mardanam gunavardhanam, sanskaro hi gunantara dhanam. So we were creating nanoparticles from trituration in the khalva yantra. Now equipments are there, end runner is there, age runner is there, so nanoparticles can be made. Now muffled furnace is there, which can on which we can control the temperature, control the time, control the fumigation, whatever it may be, but we can control on those equipments. What we were not able before 20, 30 years. Next, increased accessibility. I am very much afraid that after our all efforts, the public, which is the king, because we all are creating facilities for the public or society. So the public, who is king, is not ready to divert their mind regarding Ayurveda. Yoga was non-invasive therapy, nothing was invest exercise. So public or global public took it as exercise, minor exercise without gym, because no equipment is needed. So this yoga is popular now in comparison to Ayurveda. Otherwise, yoga is a minor part of our Ayurveda Swastha Vrat. Out of all therapies, Panchakarma, Devyapasra, Yuktipasra, this yoga is a small part. But due to its non-invasion, because public can believe on you when we can provide the result due to medicine. So medicine is separate. Now yoga is medicinal or non-invasive method. So everybody is trying to do. Some harm will not be there if effect is not there in this way. So we have to reach to general public, number one. I am observing. My Ayurvedic college is there in a isolated area, just 40 kilometers far away from Bhopal. From 4 years, brand new college. And recently, within 1 year, we have established 635 beds of medical college. Just see the patient, comparison of patient. Public comes directly to allopathy. Even though there is a community health center available in 1 kilometer's distance. Then also, in public's perception, allopathy surgical equipments are better. Surgical equipments do not have any branding of allopathy or Ayurveda. These are the inventions of physics experts, chemistry experts, biochemistry experts. So all of us can use it. That is not of allopathy equipment or Ayurvedic equipment. Equipment is equipment, and equipment can be used by anybody. So we must try to use equipments whenever and wherever is necessary and possible, both. Then, if we talk about quality control, out of 8,000, I am Vice President of Ayurvedic Drug Manufacturer Association of India. So near about 9,200 Ayurvedic manufacturers are there. And out of which, top 100 or top 1,000 you can consider, top 1,000 manufacturers are really taking care of their quality. It is unfortunate that we have so many ingredients. I am writing to government also. I am submitting memorandum also. One solution is not there. What is the necessity to keep Vanslochana in our formulation? Ashtavarga is not available frequently.
Yeah.
So what is the necessary to keep that Ashtavarga? And we will highlight on the level that Ashtavarga Yukta. So
Yeah.
public perception is not clear regarding Ayurveda because due to our claim. Hing, simple hing, hingu. Hingu is not proper or quality. From 1000 rupees kg to 1 lakh rupee kg, you can get the hingu,
Yeah.
what we
I
are
know.
eating in our chonk or bagar, whatever we can say. So, quality of medicine is also very necessary. Now, recently, one rule has come from government, and I
Okay.
welcome that rule. I welcome that rule, though I was in Imami or Jhandu manufacturer for 3 decades. That rule 170 stops manufacturer to our claim, number one. Stops actor and other persons who have not used that to publish it. Means if you have genuine product, you can promote it, market it with your evidence-based knowledge, not with the actors Virat Kohli and then Kapil Sharma and then so list is or top companies can afford it and top companies are using this. But unfortunately, now this practice will also go stopped by the
Oh,
government.
very good. Very good.
Government has launched one portal, sir, to report. Anyone can report regarding fake advertisement, overclaim, or excess exaggeration of the indication. Anything can be complained there on AYUSH portal. Recently, day before yesterday, our AYUSH minister has launched it.
Oh,
So
very good.
this is
Thank,
also a
congratulations.
welcome
It's
step
very good.
from the
Very
government.
good.
Now, emphasizing holistic and personalized approach. Our Ayurveda is Prakriti based, that means individualistic treatment. It is not a 303 bullet, it is 0.22 bullet, specific bullet, and it acts on the target. But it is also truth that Ayurvedic medicines are not working on one system. If we take any medicine, it starts its effect right from the digestive system to the system for which it is given. So many systems are being treated with our medicine. Like this, allopathy is creating harmful effects on all system because they are giving targeted medicine for prostate, this is there. For thyroid, thyroxine is there. For endocrine, insulin is there. But that insulin is not working only on the pancreas or
Yeah.
digesting the sugar. It harms in the body regarding our holistic wellness. Then our wellness centers are being opened now. Modi ji, respected Prime Minister Modi ji, has announced and started establishment of wellness centers in India that will have preventive measures in focus, and treatment will also be there, but wellness will be in focus. So it is also welcome step. Our Ayurvedic graduates will learn there. Our Ayurvedic graduates and postgraduates will guide there to the patient that please prevent your diseases. So the expenses on medicine, millions of rupees or dollars, will be saved definitely. But this message should be communicated to maximum of the society. Now, lifestyle. As we know, we are just against working the rule of nature. Just against. Microwave creates radiation. Our towers creates radiation. Food color create toxicity. So everywhere you can say within 30 years, excellent growth of cancerous patients are there. Because we are using that. We are using in our food, we are using in our kitchen, means we are surrounded by the radiation of electrical currents, number one. this telephonic currents. Number two, towers, microwave, etc., etc., etc. What solution allopathy has for this? Because they are just shastra karma to remove the portion, and that is also being again and again repeated. So recurrency is there, number one. Kashta there, means trouble is there. Maybe chemotherapy, maybe radiotherapy. Our Ayurveda can be the solution of that if we will be able to teach the public that Ayurveda is better. दादी माँ के नुस्खे आपकी किचन में थे, आप उनको पहले यूज कीजिए, उसके बाद आप केमिस्ट में जाइए. सर, मैंने कलकत्ता में एक सीरीज चलाई 780 लेक्चर्स की. फिजिकल लेक्चर्स थे उस समय, बिफोर कोरोना. मल्टी मिलियनर्स की फैमिलियां आती थी उसमें. नाम रखा था मैंने किचन हॉस्पिटल.
ओके, बहुत अच्छा.
क्योंकि हमारी किचन में एक साथ कम से कम 150 आइटम रहते हैं. ये किसी ने गौर नहीं किया, ना होम मेकर्स ने गौर किया, ना फैमिली हेड ने गौर किया. ये गौर करती थी बेचारी दादी, वो न्यूक्लियर फैमिली से खत्म हो गई. न्यूक्लियर फैमिली से दादी, ताई, चाची, मामी, ये सब रिश्ते निकल गए. बच्चे तो कौन, मदर फादर बच्चे जो ड्यूटी चले जाते हैं, बच्चा बच्चा जो मोबाइल में और टीवी में लगा रहता है. खत्म कहानी पूरी न्यूक्लियर फैमिली की. तो आज ये चीजें, यदि किचन हॉस्पिटल जैसी चीजें अवेयर हों, और दूसरी हम बताएं कि देखिए ये चीजें इतनी इजी टू यूज नहीं है. आपको माइक्रोवेव धड़ धड़ करके हम गर्म कर रहे हैं. जो माइक्रोवेव की वेव्स 10 सेकंड में खाने को इतना गर्म कर देती हैं. मेरे एक मित्र थे अवधीश पांडे, जो ये इसमें ऐसे शुभम में थे. वो कहते थे माइक्रोवेव और चिता की जलना ये दोनों बराबर की हैं. जो इलेक्ट्रिक फर्नेस में हम चिता जलाते हैं और जो हम माइक्रोवेव में पकाते हैं, उनका सबका लगभग एक ही मोडस ऑपरेंडी है, और वो अपने को नुकसान पहुंचाता है. उन्हें प्रूव किया था. इंफ्रारेड, अल्ट्रावायलेट, इनके बीच में क्या हर्ट्ज की वो रेट है, वो है मेरे पास. अपनी वेबिनारों में कई बार मैंने उसको रिपीट किया है. तो आज हम बच कैसे सकते हैं? लेकिन शर्त इतनी है, आदमी टूल्स भी यूज करेगा, आदमी लाइफस्टाइल भी डैमेज करेगा, आदमी वो नशे भी करेगा, और उसके बाद चाहेगा कि डॉक्टर साहब मैं नशे करता रहूं, मैं सिगरेट पीता रहूं, आप मेरी खांसी ठीक कर दो. मेरे जो एक्स प्रिंसिपल थे वो बेचारे ओवर स्मोकर थे, चेन स्मोकर थे. वो लंग्स की ILD से गए, इंटरस्टिशियल लंग डिसीज से एक्सपायर हुए, लेकिन चोरी छुपे कहीं भी जाके वो फूंक लेते थे. तो आज के आदमी की साइकोलॉजी सर बड़ी गजब हो गई है. आज आदमी चाहता है, मेरा आयुर्वेद जो कम होने का कारण हुआ सर, ये मुगल का, ये बुद्ध का, ये एलोपैथी का ये कारण तो है ही है. आदमी की साइकोलॉजी से मेरा आयुर्वेद का पतन हुआ है. आदमी चाहता है कि मैं 500 mg की गोली में और रामबाण ले लूं, मेरी दवा ठीक हो जाए. ये एलोपैथी में हो सकता है क्योंकि वो केमिकल है, टारगेटेड केमिकल है, हार्मफुल केमिकल है. तो वो 500 mg में आपको विषाक्त असर या जो भी असर है उनका दिखा सकते हैं. मेरे आयुर्वेद की सर डोज थी 10 ग्राम्स ऑफ चूर्ण, 40 ml ऑफ आसव एंड अरिस्टा, 20 to 30 ml ऑफ लिक्विड कषायम. आज आदमी को देंगे तो वो कहेगा वेटरिनरी डोज दे रहे हो क्या डॉक्टर साहब?
हाँ, बिल्कुल बिल्कुल बिल्कुल. सेम थिंग द प्रॉब्लम दिस वन. बट
मुझे सर कैंसर डायग्नोज किया 2002 में. आई वाज ऑन टूर फॉर झंडू कंटिन्यूअसली इन 25 डेज ए मंथ. तो मेरी ग्लैंड्स हो गई पेट में. मेरे 3 बड़े हॉस्पिटल्स ने मुझको क्लेम वो डायग्नोज कर दिया कि इसको मैलिग्नेंट फाइब्रोमा है. आई वाज शॉक्ड देयर. मैं नहीं समझ पा रहा था. मुझे रेडियो वो कीमोथेरेपी लिख दी गई थी. अब मैं वहां से लेफ्ट अगेंस्ट मेडिकल एडवाइस होके आया. आप विश्वास मानिए, मैंने बिना गिने आरोग्य वर्धनी और कांचदार गुगुलो मुट्ठी मुट्ठी भर 1.5 साल खाई है, और 1.5 साल में एक ग्लैंड नहीं बची सर. 23 kg वेट मेरा कम हो गया था. मैं जिंदा उदाहरण हूं उसका. 23 kg कम हो गया था बेज, उल्टा 50 kg बढ़ गया मेरा.
You are what your weight now? You had the more 23 kg, eh? जय श्री
सर,
गणेश.
क्योंकि आरोग्य वर्धनी पाचक है. कांचनार
हाँ
गुग्गुलू जो है वो भले ही आपका हाइपर लिपिडेमिक हो, लेकिन ये आपकी आरोग्यवर्धनी पाचक है, लिवर एक्टिवेटर है, हेपेटो प्रोटेक्टिव है। तो उसने अच्छी भूख बढ़ाई, उसने संभ्रंगण किया। और मैं
हम्म,
जो कब के मारे मुझे मरीज समझ के ले गए थे घर वाले, वो मेरे
हम्म,
मोटापे से परेशान है अब। और ये वेबिनार
ओके,
से मोटापा और हो गया, क्योंकि 4 घंटा में रोज बैठता हूँ। तो आयुर्वेद की जरूरत है कि हम पब्लिक में घुसें और
हम्म,
पब्लिक को हम फोर्स करें कि भाई
हाँ
रिटर्न बैक टू द नेचर। वी कांट
यू
अवॉइड एसी, वी कांट अवॉइड माइक्रोवेव, वी कांट अवॉइड फ्रिज। ये 3 चीजें। मेरे ग्रैंडफादर ने सर फ्रिज को घुसने नहीं दिया था घर में, जब तक
हम्म,
वो जिंदा थे। 95 की एज में गए। राजवैद्य
हम्म,
थे, सिंधिया फैमिली के। उनका कहना
हम्म,
था कि जब से लोहे के बर्तन में खाओगे, लोहे जैसी बुद्धि होगी। वो पीतल और
बिल्कुल
कांसे
सही
के
बात।
बर्तन प्रेफर करते थे। और
हम्म,
फ्रिज तो इस घर में मेरे जीते जी आना नहीं। क्यों? क्योंकि बासा खाना सीख जाओगे।
हाँ
रोज सुबह ताजा बनता है, शाम को ताजा बनता है। आप फ्रिज ले आओगे तो आप बासा खाना सीख जाओगे। और वो
से,
हमारी
से,
बीमारियों की जड़ है। वी आर
बिल्कुल।
अनएबल टू अंडरस्टैंड। जड़ तो हमारे घर में है सर। और उसमें हम आयुर्वेद को कैसे इन्वॉल्व कर सकें, आयुर्वेद को कैसे कम्युनिकेट कर सकें, ये हम वैद्यों की ड्यूटी है। और वो इसी में लगा हूं सर। आज 2500 वेबिनार पे पहुंचने वाला हूं। कहीं ना कहीं, कभी ना कभी तो किसी के दिल में कोई ना कोई बात तो असर करेगी कि हमारा आयुर्वेद जिंदाबाद है। मैं
वो
मैडम मयूरी जी को सादर आमंत्रित करता हूँ। आई वुड लाइक टू इनवाइट मयूरी जी फॉर हर ओपिनियन। मयूरी जी, वेलकम। प्लीज अनम्यूट योर सेल्फ। Our next webinar is on sexually transmitted diseases.
हम्म,
And please stay with us. Mayuri ji, please.
ओके,
Sorry for
राइट
it.
राइट।
Sorry, I don't understand
I would
what
like to
you.
invite you to communicate your opinion regarding our discussion, whatever was going on.
Yes, I agree about the microwave. The rays emitted by the microwave. I have always felt that they would not have a good effect on a person's health. And I prefer even to make a porridge on the gas hob rather than use the microwavable porridge sachets. And
Even mobile, madam. Mobile creates radiation to our whole body. And we are keeping that mobile near our head on our sleeping status. That is life. Mobile is life. We are slept.
Yes, that's right. I mean, I am not really very fond of mobile phone, but I had to discontinue my landline. And I find that especially in an emergency, mobile phones are very handy. And not that I don't spend a lot of time on mobile phones. It's only maybe WhatsApp, anything like webinars like this one. I'm not even very fond of mobile phone because,
Great, you are saved. You are
yeah,
saved, madam, by God's blessings.
yeah. Thank you. I am learning something from this webinar, yes, and I am taking some Ayurvedic medicines for things like high blood pressure and acidity and cholesterol. The cholesterol Ayurvedic medicine I took it gave a positive result. My blood test now is not showing any more cholesterol. I just started showing cholesterol now. 6 months of down the line, there is no cholesterol on my blood test result.
Madam, in this cholesterol or sugar, in my opinion, our time of dinner and the status of our body after dinner is important. God has given us 35 feet long intestine, and that has 3 tanks: alkali tank, acid tank, then again alkali tank. And there is no movement up to stomach. We are keeping our food into stomach and we are lying down. That means we are sleeping. That means that food is being digested in the morning. When you awake and when you start your movement, that will go down. And if it reaches to duodenum, then it will have peristaltic movement like an earthworm and it will go away. But up to stomach, there is no movement. So we all, whoever is taking late dinner is the culprit to have the LSD. Because that food is not being digested, that will be digested in the morning when you awake, and that will be going down from the gravity and movement into the required chamber. So these we are doing, madam.
I do give a lot of time before my dinner, after my dinner, and before going to bed. About 3 hours, and I feel the food has moved away from my stomach. I actually listen to my body, so I know what you are saying. But I have got hiatal hernia, so because of that, I get acidity. And but now
my wife also has.
Yeah. So now it's better with the medication and, me having a 3 hour or sometimes 4 hours gap between having the dinner and going to bed.
Thank you, madam. Please take part, active participation. We are sharing our knowledge. Please subscribe our YouTube channel. We are conducting 3 webinars daily on different subjects, and all subjects are unique. So please subscribe our channel. You can view all the webinars. Avatar sir.
I would like a topic on nose neurology and all that.
Yes, it was done by Avatarji also. Yet so many topics are there. Please go to our YouTube channel and search by your topic. You will find definitely, because we are reaching to 2,500. On urology, we have conducted 20 webinars.
Neurology, nose.
Urology, yes. Kidney stones, kidney problem, kidney pH.
No, I mean neurology, N-E-U.
Yes, on neurology also.
Nose.
On neurology also.
Okay.
Not only urology.
Yeah.
On neurology, more than urology.
Okay, fine. All right.
Avatar sir, please unmute.
Thank you very much. A lot of knowledge you shared today, what you are experienced that one. And also, same, I am also worried, you worried about that one. What is the future of the Ayurveda? What is Ayurveda future is what you say. I'm 100% agree with you. I'm agree with you. People don't want to come. But in my positive views, I think this way. In India, is still at least 80% is people are can't afford the hospitals. We no need to target people who are very rich. They can straightway go to hospital. Even 20%, 30% people who are the poor people, they can't afford the hospital. We have to treat them and treat them properly with the Ayurveda. They are our ambassador then. We need this one. I'm experienced in the UK. UK have the one benefit, any health problem, they are free for every patient. No need to spend a lot of money. In the UK's, people only come to us in the Ayurveda when they are last stage. They won't come before that one. When they start, they won't come. When hospitals say, sorry, we can't do anything, when they are from 10 year, 15 year, 12 year, they're suffering from diabetes, then the thyroid, everything, they reach the very limit. After the metformin, glycoside, then after that, when they say you have to need the insulin, then they start thinking about Ayurveda. So that time, what is the condition of pancreas? You understand, you are the very well-known doctor. You've done so much work on that one. I always say, why not you come before? oh, Ayurveda is, we can't find the good Ayurveda practitioner. This is the complaint of the, and I know, you know very well, we discussed on this one so many times. So many Ayurveda people, they are certified, but they don't have the confidence. They are not qualified, I say, to do the treatment properly. They know the medication. They know everything like a good chemist. They know the so many in their stock. They can keep the stock, but that stock won't work that time. On the beginning, they can work if medication is good, companies provided. There are so many, we don't have to put the name, I can't. There's good company, they're providing good medication, no doubt. But those medication, when stage go third or fourth or second even, every disease have the stages. They start, for example, one metformin morning, one evening for the diabetes. Then they say take 2 and 4. Then they say, oh, take the glyphosate. If they don't control, they say no. They made the insulin, or you have to go to insulin. 10 after 5 years or 10 years, that time, they have the vitamin B is very low, vitamin D, the bones, and you name it, so many other side effects of that one. But that time, if somebody come, I got diabetes, when I diagnose, what else you have? Oh, no, I have the control of the blood pressure, I taking a tablet. What does it mean control? You diagnose with the blood pressure. Blood pressure is not that, I always say blood pressure, I treated so many blood pressure BP patients. I'm not treating the blood pressure. I'm treating the system is making the balance. What is the reason of blood pressure? Blood pressure never be same. Sir. If you choose the 10 time in the blood pressure, always sir. Different.
Very right.
So what is the reason? You have to do it that one. You have to control that one. Then we have to everything. Then they say, oh, I say, don't worry. This is the reason I say, and I'm doing that one, Pavanji. I got the lot of evidences, and people, they say when yesterday was so many from Europe doctor, when they see the presentation, some presentation done my patient. When they say that,
बिल्कुल ठीक कहा आपने, क्योंकि अब कोई इंडिया में गरीब नहीं है सर. फ्री का खाना मिल रहा है, मोदी जी फ्री का खाना घर पहुंचा रहे हैं, नंबर 1. और हर आदमी का जो गरीब है कम से कम उसका 5 लाख का बीमा है. यदि आयुष्मान कार्ड उसके हाथ में है तो वो आयुर्वेद के हॉस्पिटल की तरफ देखेगा भी नहीं, वो सीधा घुस जाएगा एलोपैथी हॉस्पिटल में इलाज कराने.
That is because he have the 5 lakh ka bima, that is he go to there. But I still I'm not saying this one, they try there. Don't need to give them. In the Chinese say, don't give the fish every day to the person. Tell him to how you catch the fish. Don't give their plate. I'm not believe that one. I'm not every day give the food to their plate. No, they have to
now
make their own
food. Our time is over, and we have
to
start next
so
webinar.
Thank you very much. And
thank you,
it's nice. So many things you shared today. And Ayurveda, I still say, Ayurveda practice also should we become more expert, more learn how to diagnose, how to make the medication. That definitely